Hello and welcome to It's a Code You, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. In this episode of It's a Code You, we're going to be talking about how to get through the holidays when you're working in healthcare. The holidays themselves can be a stressful time. There are financial stressors, requests for time commitments that can cause you to feel spread thin, and just the overall expectations that you may feel from family and friends. When you factor in things like having to work holidays or there being less of a workforce due to time off, the holidays can feel anything but festive. So today I'm going to talk about some of the things that might make working in healthcare more stressful during the holidays. And then I'll talk about some of the ways that you can try to find some balance and joy amidst the chaos. Above all, I want to validate those feelings of overwhelm and stress. So I'm going to start by talking about healthcare in general around the holidays. Flu season can start as early as September in a lot of places, but it can continue into the holidays. And when you factor in people traveling more, comorbidities, and chronic conditions, you may see more patients in hospitals for complications during the holidays. Things like drinking too much, traveling, and viruses can contribute to more visits to the hospital. Many people take time off around the holidays, sometimes in the 2 months surrounding the holidays, to manage all the different obligations to family and friends. This can mean longer shifts, overtime, and less time to balance work with self-care for healthcare workers. Aside from the toll that stress from work can cause during the holidays, healthcare workers can also experience emotional stress. If you're not able to make it to certain gatherings or requests for your presence, you may experience guilt or feelings of resentment. If it feels like family and friends don't understand the demands of working in healthcare, especially around the holidays, you may experience frustration or resentment. Trying to fit everything in for things like school events for your children, parties and gatherings of family and friends, and work demands can leave you feeling exhausted and like you have no time just to breathe. While everyone's situation is very different, doing your best to try and create some room for positive experiences and joy can really help you get through the holidays without feeling like you merely survived them. The first tip I have is to try and take care of your needs. Do you enjoy your cup of coffee in the morning and having the quiet time before you start a busy day? Do your best to protect that time. Your sleep can become difficult when you're running from event to event. Try and protect your sleep schedule as much as you can, especially if you do shift work, as the switch from day to night can be difficult for your system. Now, we've talked about this next tip in a few different episodes, but using mindfulness can help to reduce stress. Taking even 5 to 10 minutes a day to engage in some sort of mindfulness practice can help to lower your stress and keep you feeling more grounded, helping with feelings of anxiety. Some suggestions for how to do that would be things like sitting in a quiet room and doing some focused breathing. You could find a guided meditation that lasts only a few minutes. Journaling what you're looking forward to about the day or something that you're grateful for at the end of the day can be very helpful. And it can be a small thing. It doesn't have to be a life-changing event in order for it to work as a gratitude practice. Think about what you cherish about the holidays. Is it festive decorations? Do you like wearing over-the-top festive clothes? Think about small ways in which you can bring some of what you love into work with you. Not only will it boost your own feelings of joy, but it may brighten someone else's day as well. And making other people experience joy is good for us. Prioritize your time. Think ahead to what events and obligations you want to make space for, and give yourself the space to say no to others and protect what feels good to you. Are you missing your family that you can't go visit this holiday season? Schedule a Zoom call with everyone. Wear ugly holiday sweaters, play games, have prizes. Focusing on ways that you can connect will help you to feel a little less isolated. Think about getting some extra emotional support if you need it. Does your healthcare system offer any wellness programs or an employee assistance program for therapy sessions? Think about taking advantage of these types of offerings when available. It may provide you some space to work through any difficult emotions or challenging situations while also helping you to feel more supported. If your family and friends live close by, consider asking if everyone would be willing to celebrate on a different day. Sometimes, with travel for farther relatives, it may be more desirable for those you want to celebrate with to find an alternative day to be festive and celebrate the holidays together. I want to validate that the holidays can be stressful in general. It can cause complicated feelings about money and time. And when you work in healthcare, that can add another layer to everything about the holidays. The work you do is important. You're helping people and caring for people, and that matters. You matter. Make sure you make space for that acknowledgement this holiday season. If you have any questions, comments, or feedback, please contact us at dhbhs.media@hitchcock.org. We appreciate you listening and hope you have a wonderful day.